Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I talk often about being proactive as opposed to being reactive. And there's a reason why, because I've talked to so many people throughout my career where they would say, well, if I would have known, I would have done something different. Had I have known that I had this problem, I would have changed my diet, or I would have, had this supplement added into my routine if I thought it would have helped. So today I want to talk about being proactive when it comes to your cardiovascular health. So I'm Amanda Williams, MD, MPH, and we know that cardiovascular disease, which includes things such as coronary heart disease, cerebral vascular disease, we look in peripheral artery disease, atherosclerosis. We know that all of these are heavily influenced by things like insulin resistance, high blood pressure, hypertension, dyslipidemia, inflammation, and different coagulation properties. So if we have more of a tendency to have thicker blood, for example, or thinner blood, this can have an impact on our cardiovascular health. Why does one person develop a blood clot and someone else doesn't? Why can one person, have a cut and they can't seem to clot up and they keep bleeding, where someone else does not? So we know that there are different factors that we can certainly modify when it comes to lifestyle modifications, when it comes to, increasing our daily activity with exercise, when it comes to adhering to a Mediterranean diet. But many times we don't look at what we can look at now, which is looking at genetic predispositions to cardiac problems. And this is important because we know that cardiovascular disease is the leading contributor to both morbidity and mortality, with over 17 million deaths occurring annually due to cardiovascular disease. We recognize that as we get older, these risks begin to go up. But we now actually can look at specific inherited genetic components that might make a difference in terms of how we exercise, what we eat, what supplements we are taking. So we have our cardiac health test, which is looking at 8 different genes. So it's 8 specific genes in the human body that can indicate if you have a genetic variant, which could actually increase your risk of a cardiovascular event, such as a heart attack or a stroke. So we know that now that we can actually pinpoint specified genes, and if we know that there's a problem with those, then we can make those changes ahead of time. We can't change the gene, but we can certainly change up what you're doing to address that gene variant. So this particular test is looking at things such as ApoE. Now, oftentimes when we think about ApoE, we are thinking about it in the setting of Alzheimer's disease. But we know that ApoE is the gene that is associated with the risk for Alzheimer's disease, but also for cardiovascular disease. And there are different variants. And so by assessing which particular variant you have, this can give us a lot of insight as to what you should be doing when it comes to your lifestyle modification. So when we look at the cardiovascular system in ApoE, we understand that ApoE is involved in the transportation of fat. So the fat molecules that are going out of the circulation and into the cells. So if there is a problem within this, then we can see what we need to do in terms of cholesterol modifications, or how we can get the body to better metabolize cholesterol to avoid things such as a heart attack or a stroke. So this particular test that we offer looks at ApoE. So not only for the setting of, are we at a greater increased risk for potentially developing Alzheimer's disease, but also looking at its impact in terms of the management of cholesterol levels. So we know that that's a direct correlation for risk for heart attacks, strokes, high blood pressure, coronary heart disease. This is also looking at what is known as prothrombin or factor 2. And what I was mentioning before, why do some people throw a blood clot and someone else doesn't? People have heard of, pulmonary edemas, things along that line, or a DVT, a deep vein thrombosis. So by looking to see if we have a gene mutation within factor 2, this can clue us in to the way that our body is sending that message. Because remember, that's what our genes are doing. They're passing off a message. It's kind of the playbook. And if that playbook is missing pages, then that's going to be a problem or potentially become a problem. So by looking at factor 2 or prothrombin, we can see if there's a gene variant in that, this could put you at a greater risk for forming a blood clot, which in return, what does that tell us? Okay, well, we need to make sure that we are always staying active. We have to make sure that we are getting in the right nutrients and antioxidants. We have to make sure that we have adequate vitamin E on board. Grapeseed extract, for example, which we know is very beneficial for overall circulation. So it gives us an idea as to how to be proactive as opposed to reactive. This is also looking at factor 5, which once again is looking at that coagulability, which we know can lead to thromboembolisms. So those blood clots, once again, if we see that there is a factor 5 gene variant, then once again, we can make those modifications so that does not become a problem. So if that missignaling, that incomplete message is not getting signaled through, that we are taking the right steps to try to avert a catastrophe. And that's really what it comes down to. And it's really quite amazing that we actually have the ability to look and analyze our genes at this level now. This looks at a gene called 9p21. And this is a very important gene to look at because this is a gene that is associated directly with atherosclerosis and coronary artery disease and arterial stiffness. If we see that there is a gene variant that is occurring within 9p21, then we can make sure that you're taking the right nutrients to support those endothelial cells, the vascular lining. This looks at Enos, which is ENOS, and this influences your nitric oxide levels. If there is a gene variant and Enos is basically broken, then this can create an issue with hypertension, which can lead to peripheral artery disease, which can lead to heart attacks, strokes. If we know this, then we can make modifications. We can make sure that we have things like beetroot extract on board for the natural production of nitric oxide in the body. Arginine, for example, which we know can help to enhance nitric oxide production. So it's being proactive once again. It looks at something known as AGT. And the AGT gene is essential for maintaining blood pressure. So people who have a variant in that gene can be at an increased risk of developing high blood pressure. So if we know this and say your blood pressure is maintaining at healthy levels, which is a great thing, but we know that you have this risk, then we have to make sure that you're doing the right things in terms of your diet, in terms of your exercise, in terms of supplementation. Are you taking adequate magnesium? Are you taking adequate amounts of omega-3s? Resveratrol? These are the things that we can be proactive upon. And this is also looking at a gene known as SLCO1B15. Now that's a lot of letters there. So it's SLCO1B15. What this is actually looking at is how well your body could manage or metabolize statin medications. Well, how many people in this country are prescribed a statin medication? That's those cholesterol-lowering medications, many people. Well, what if you have a gene mutation that indicates that a statin is not going to be as effective for you? And that actually taking that statin may not do much for you at all, except for potentially create havoc with stripping away your CoQ10 levels, stripping away omega-3 levels, lutein levels, raising havoc within the liver, driving up liver enzymes. So this particular test, the cardiac health test, gives us all of this information. It also looks at MTHFR. And MTHFR, we can see if there is a mutation within this could be a potential causation for increased levels of homocysteine. And if your homocysteine levels are elevated, then we know that this is also a secondary risk factor for heart disease, for atherosclerosis. And this is important to know because it's showing vascular inflammation. We know inflammation is the driving cause for all cardiovascular disease. So the reason why I talk about this is because it's a simple test to do. You don't have to go into a lab, have your blood drawn. You just simply order the test, or you walk into one of our Invite locations and you say, hey, I want to do the cardiac health panel. You take it home, you do a cheek swab, and what we're doing is we are looking at those genetic variants that potentially are there. So you send it off to the lab, we get the results back, and then we can see. We have that full playbook. We can see what's going on. Are there any increased risks? And if so, how do we go about managing those risks? So it's all about being proactive. It's very, very simple. I always say, doing a genetic test like this, it's simple, one and done. It's not like you go in and 6 months later you have to have it tested again. We're not going to change the genes. The genes are the genes. But what it will give us is a lot of information as to how to manage any of those potential gene mutations, or hence as we call them now, variants. So I definitely encourage you to check it out on our website. It's the cardiac health test. So easy to do. Simple cheek swab. It's looking at these 8 specific genes that are all directly correlated to different aspects of our cardiovascular health. And it can really give you a lot of information as to how you need to go about lifestyle modifications, dietary changes, and which supplements should be on your daily routine. So I want to thank you so much for tuning in to the Invite Health Podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health Podcast.